I'm Dr. Bob Hopkins. I'm a professor of internal medicine and pediatrics. I run the Division of General Internal Medicine here for UAMS. And I also am very pleased to be able to offer help locally and nationally to a number of efforts to evaluate and improve vaccination practices. So there have been a number of concerns that I've heard about our coronavirus vaccines. And let me try to set the record straight with what we do and what we don't know. There are right now 2 messenger RNA vaccines that are far along in the evaluation process. There's one vaccine that has been submitted to the FDA for emergency use authorization and has been evaluated by the expert non-governmental committee called VRBPAC. And they've made a recommendation for approval of this vaccine for use in people 16 years of age and older to prevent coronavirus. Another similar messenger RNA vaccine has been developed by another company and has also been submitted to FDA for this similar evaluation process, but has not yet been vetted through that committee. I expect that to happen any day. There's also a committee of the CDC called the Advisory Committee on Immunization Practices that will then assess this information and recommendations for use. These vaccines have been shown in the trials to be highly effective at prevention of coronavirus disease, and particularly severe coronavirus disease. They do cause some local reactions. There are a significant portion of people in the trials that developed a sore arm, fever, fatigue and malaise, headache, and achiness. And generally those lasted 24 hours or less in the trials. But I have publicly committed that once I am up to get the vaccine, once I have availability to get the vaccine, I will take the vaccine myself, and I will recommend it for others that I work with and in my family. Well, based on the information we have so far, we are starting off with healthcare workers, because if we don't have healthcare workers, we don't have healthcare to provide to patients. There's also going to be very quickly efforts to vaccinate patients in nursing homes because they're at the highest risk of having death or severe disease from COVID-19. Soon we'll be broadening that out to other essential workers in our communities and then to patients who are at risk. At present, we really don't know specifically how long the vaccine protection is going to last. That's something that's actively going to be studied going forward. It started with the trials and it's going to continue in our current environment. But we need to monitor that. We estimate that probably we're going to have to get somewhere between 60 and 70% of our population immunized in order to provide immunity for our community, the term that many people call herd immunity. I prefer the term community immunity because we're communities of people, not herds of animals. The issues with pregnant women and children are that these are groups of we have to specially protect when we think about children, when we think about pregnant women who are also carrying another life with them. And so we need to go through that extra level of due diligence, of focused studies on those populations before we take a chance on vaccinating that high priority and concerning a group of patients. The other thing that I think it's important for us to recognize is we are now getting ready to launch the first wave of vaccination. While that first wave of vaccination focuses on healthcare workers and folks at highest risk in long-term care facilities, I am hopeful that over the next few weeks, we're going to get additional amounts of vaccine available so that we can then expand to provide vaccination to others that may work in healthcare and not provide direct patient care, to people in our communities that are first responders, so that we can protect our grocery workers, so that we can protect our police, and others that do essential jobs, and so that we can then start expanding our efforts to vaccinate older adults, younger adults, all of our society, because we need high levels of vaccination before we can have protection from this disease. But it's really critical to go back to an old message that I've focused on now for many, many months. And many of you have heard me rant on about social distancing. And wearing that mask, as uncomfortable as it is really important. Washing your hands, don't go into crowds. This is not the time to let down our guard, because we are on the verge of having that vaccine here to help us develop community immunity. But we've got to do everything we can to protect our friends and family now until that vaccine is out there and we've got people vaccinated. A lot of concerns about the speed of this vaccine development process. We talk about the fact that most vaccines to develop take somewhere between 5 and 15 or 20 years to get developed. Well, the COVID-19 vaccines have been developed very rapidly, but that has come as a result of some major factors. First, we had a head start. We've been working on developing vaccines against coronaviruses going back to SARS 20 years ago, and then the MERS coronavirus about 8 or 10 years ago. Those gave us a jump start on the science side. We've also had tremendous financial investment by our federal government, by other governments, by non-governmental organizations, and by industry. Tons of money and efforts in many, many laboratories around the world to work on development of coronavirus vaccines. But we have not skipped any of those critical steps. Normally, a vaccine development process is an A to B to C to D to E process. What we've done in this coronavirus development process is some of those steps have gone like that A-B. But we've also taken some of the steps and put them in parallel. So we're doing large trials in human beings, okay, large trials, 30, 40,000 people in these trials, the two that have been submitted for approval. At the same time as that's going on, companies are building factories. They're bringing in the raw materials to make vaccines. So we're doing those safety and effectiveness studies, but we're also preparing to get vaccine out at the same time. The FDA is looking at all of those processes. And so we've shortened that timeline tremendously because of investment and advances in science. We are not shortcutting safety and effectiveness. Those are absolutely critical. And even more important, once we start vaccinating people in this emergency use authorization, we have many systems that the FDA, that the Center for Medicare and Medicaid Services, that the U.S. Department of Health and Human Services and the CDC have put in place to monitor very closely, look for safety signals and evaluate those so that we can make sure that we're safely vaccinating and protecting people against the coronavirus. We all know that the coronavirus has had an increased impact in communities of color. We've seen reports about increased rates of hospitalization, increased rates of death, increased rates of severe disease. There have been historical and ongoing difficulties with disparities in care to communities of color. To help address this, the FDA has insisted that the companies that are doing trials of these vaccines include populations that are representative of the diversity in our country. And in the data that's been presented so far, there's no signal that there's any difference in safety or effectiveness in people of color as opposed to those that are not of color. There doesn't seem to be differences in people that were evaluated in different areas. And in my view, vaccinating widely, effectively vaccinating across our entire population is at least one step that we can work on trying to resolve some of those historical disparities in health care for communities of color. It's a very important consideration. At this point, we really don't know how long these vaccines are going to be effective. That's something that's going to be monitored actively in those that are in the trials, but also as we start vaccinating people more widely through the emergency use authorization. So we will get better information over time. But what we do know is that some of the levels of antibodies, our body's tools that we use to fight infection, levels of antibodies in these trials appear to be higher than people even that had severe coronavirus disease. So that's a good indicator that it's likely to be durable protection. But whether that protection is going to be months, whether it's going to be years, whether it's going to be decades or lifetime, we really don't have enough information to answer that yet. There's a question about vaccinating people with immune system problems. Okay, those who may have cancer, may have other diseases that affect their immune system. We don't have a whole lot of data on those types of patients. There were some patients who had HIV infection included in one of the vaccine trials. We don't see any reason to suspect that the vaccine is going to be less safe or any less well tolerated in those groups. It may be because of the immune system problems. They may not be quite as potent, quite as protective over time. But because those people are at such high risk, that's a group that really needs to be vaccinated and in one of our early phases of vaccination. We cannot let our guard down. Vaccination takes time to help develop protection. And we need to have enough people in our community vaccinated for the vaccination to provide community protection. So it is absolutely important that we continue to wear our masks anytime we're outside of our homes or if we're in our homes and sick. We need to continue to socially distance. We need to continue to wash our hands. We need to continue to stay away from crowded settings because, now is not the time to let off those pressures, those public health measures that are there to help protect us. We need to double down on them. We need to do even more of those as we start vaccinating because that's going to get us that much closer to that time when we can back off on some of those things, when we've got a large proportion of our population vaccinated.